Hi, everyone. Welcome to tonight's live expert session on acupuncture and autoimmune disease with Dr. Erica. She's a nationally certified and licensed acupuncturist with a doctorate in acupuncture and Chinese medicine. So she's very qualified to speak about this topic and answer our questions tonight about how acupuncture may benefit lupus patients. So I'll let Dr. Erica share a little bit more about her background and her practice, and then we'll dive into how acupuncture actually works. And then we'll cover the questions that you've all been sending to us. If you have new questions, please feel free to add them in the comments below, and we'll go through those at the end. So Dr. Erica, do you want to share with us a little bit about your
Yeah,
background?
thank you for having me. Again, my
Sure.
name is Dr. Erica. If you look me up, my name was Dr. Erica McDonnell. As of recently, that has changed due to marriage, so it's now Dr. Erica Nutting. So if you do
Congrats.
look me up after this, look up Erica Nutting because that's what everything says now. But like Brianna said, I do have my doctorate in acupuncture and Chinese medicine, so I am an acupuncturist. I have been practicing for almost a decade. And I've worked in various clinical settings, private practice, community acupuncture, medical clinics, but currently working at TIA, which is a women's healthcare clinic with locations across the US, including in various cities in California and Arizona and New York. So you have options, but I really enjoy working here because of the integrative approach to health that TIA takes. So I really enjoy what I do. And I'm really happy to be joining you all today because I do believe that acupuncture is a great option for helping to manage autoimmune conditions like lupus and a lot of the associated symptoms. Every person's body is different, and the way that lupus presents itself in each person is different. But the beauty of acupuncture is that it is a very person-centered form of medicine. So the treatment will always be tailored to you and your presenting symptoms at that time. I don't know what everyone's exposure to acupuncture has been or what people know or don't already know about how acupuncture works. So I always like to start with a bit of background information, like a quick acupuncture 101. So acupuncture is an ancient Asian medical practice that involves placing very small needles in specific locations on the body to elicit certain healing responses. And there are different styles of acupuncture, like Korean and Japanese, but I happen to practice traditional Chinese medicine. So in traditional Chinese medicine, there are 12 primary energetic pathways or channels that cover the body from head to toe. And each of those channels is named after a different organ. So, for example, there's a large intestines channel, or a kidney channel, or a gallbladder channel, so on and so forth. And each of these organ channels has a number of points on them. And each of those points has a number of functions. So your acupuncturist will pick points based on what you tell them is going on in your body and what symptoms you're experiencing. Uh, and so acupuncture works in a lot of ways, but two of the main ways that I like to highlight is one, its ability to regulate blood flow and reduce inflammation. And this is super helpful because for most things that go wrong with our bodies, inflammation is a driving factor, whether that's a headache or an upset stomach, or acute or chronic pain. Inflammation is the common denominator. So if we can reduce inflammation, we can help to alleviate whatever the presenting symptom may be. The second major way acupuncture works is through its ability to pretty directly affect the central nervous system. When we place needles in these specific locations, the acupuncture triggers different chemical or neurological responses. And this is particularly important because it means we can help with a number of systemic conditions, including lupus and other autoimmune diseases. A number of studies have been conducted, and they do show that acupuncture directly affects our immune system and can help disease-fighting cells work better to protect the body from illness. And to give you some more specific examples, studies have shown that acupuncture encourages the recruitment and migration of mast cells, which are the immune system's kind of first line of defense. The acupuncture also controls the function of white blood cells like macrophages and neutrophils, and it regulates the quantity and activity of NK cells or natural killer cells. And the function of those is to destroy infected and disease cells. So all of these functions contribute to both the anti-inflammatory effects and the analgesic or pain relieving effects of acupuncture. So I wanted to put all of that out there. I wanted to give a brief overview so that everyone is kind of on the same page and has a general understanding of the acupuncture and how it works. But I would love to answer some questions now about some of that.
Awesome. Thank you so much, Dr. Erica. That's really interesting. Um, yeah, I feel like I didn't realize there was so much activity
I
around
know so
those
much.
meridians. That's really
Hmm.
fascinating. One of our questions that was sent in was, can acupuncture help you have more energy when you have autoimmune disease? Is fatigue something that's influenced by those channels?
Yeah, it is absolutely. One of the benefits of acupuncture over time is improved energy, less sluggishness, decreased mental fog. I regularly see patients who struggle with chronic fatigue, and it has helped. And between the acupuncture and sometimes supplements, both work really well together. So the acupuncturists that you see may recommend some supplements as well, to kind of go along with the acupuncture to get more of the desired result. But even without that, the acupuncture itself can make a difference.
Wow, that's awesome.
Hmm.
We had two questions submitted that are somewhat similar. They have similar concerns.
Yeah.
One is acupuncture safe in lupus? And then the
Hmm.
other is, can acupuncture trigger the immune system to cause a flare? So many times, people in more of like the functional and holistic worlds will recommend things that drive up the immune system or activity, and that's not always the best course of action for a lupus patient. And they just
Hmm.
be careful. Is that something that commonly happens, like a flare from acupuncture, or is that not as common?
Yeah, that's a great question. So it is not as common. I have personally yet to see it happen. I'll be honest with you.
Oh, cool.
Um, I will say every patient is different. So one patient may handle 20 needles just fine, and for somebody else, those same points might feel a little intense and leave you feeling drained or achy afterwards. But if that does happen, you can let your acupuncturist know, and then they can adjust your treatments going forward. But again, in my experience, it has not caused flare-ups. If anything, it makes flares less frequent. And as far as like the safety aspect of it, it's very safe for patients with lupus. The side effects are few and far between, if any, whether you have lupus or not. In my own experience and also in studies that I've read, the kind of the main adverse reactions that people sometimes experience are possible lightheadedness after treatment, occasional bruising, and sometimes pain or soreness where a needle might have been. And just to give a little context to all of those,
Mhm.
with the lightheadedness, acupuncture is really good at calming things down. It really relaxes our body, and that includes dropping our blood pressure a bit. And so at the end of a treatment, we typically will recommend, lay there for a second, sit up slowly, sit for a moment, and then stand up, just because jumping up after your blood pressure has been dropped so much and you're in such a relaxed state, you can be a little, it's not unusual to feel a little bit dizzy. But that does pass. So that's not anything to really be concerned about, but just to be aware of.
Okay, more of like a postural thing.
Yeah, it's more of a postural thing. Exactly, exactly.
Okay, got it.
And then as far as the bruising or soreness or pain, at the end of the day, we are sticking needles into your body. So that is just a general possible side effect, but the bruises are usually tiny because insertion is very small. And they go away on their own within a day or two anyways. But that's about the worst that I've ever had happen.
Okay, thank you. Will insurance cover acupuncture? If not, how much does it usually cost?
Mm, good question. So yes, many insurance providers cover acupuncture now. It wasn't always that way, but in the last like 5 years or so, that has drastically changed. So many insurance providers do cover acupuncture now. Um, but if yours does not, the cost of private acupuncture treatments can range anywhere from $125 to $250 per session, depending on the clinic, which can get a little bit pricey if you're going regularly. But there are options. There are some options out there. One is that you can look into community acupuncture clinics in your neighborhood. And there they provide acupuncture in a communal space. So you'll be sitting in a chair instead of laying on a treatment table. And they'll apply the acupuncture that way. And next to you will be other people in chairs receiving acupuncture the same way. This
Uh-huh.
setup allows, yeah, it's really cool, and I think particularly great because this setup allows for decreased pricing. And also many of these places charge on a sliding scale. So it can be as little as $40 or $25, depending on the place that you find.
Wow.
And this obviously ends up being much less expensive than some of the private acupuncture treatments. The other option is to check out your local Chinese medical school. And so I know you guys are located in LA, so
Mhm.
that would look like Yosan University or Emperor's College. And they have clinics where you can be treated by supervised Chinese medicine students at a significantly reduced price. So you're still getting high quality care because supervisors who are doctors are present, but it's a lot cheaper and more accessible,
Wow.
which I love. So that's another option if your insurance doesn't cover it.
Very cool. That's
Yeah.
really helpful. I know that obviously this is not something that's accessible to everyone, and
Mhm.
that's a really great suggestion. I also just want to throw out there for anyone listening that doesn't know, Lupus LA offers emergency grants for lupus patients to help with any lupus care related costs or anything that you might experience during the year. So if you go to our website, lupusla.org, and search for emergency grants, you can learn more about how to apply for those so that anything that you struggle with, that we can help with.
Yeah.
Um, the next question that we received was, how long do you have to do acupuncture to feel results?
Yes, that is a great question, a very common one. So, the general recommendation often given is 4 to 6 treatments. However, studies have shown that patients see better results for autoimmune diseases after 10 treatments.
Interesting.
So, consistency is really what's key. Each acupuncture treatment builds on the previous treatment. It's very similar to if you are prescribed a series of antibiotics. If you're given a 14-day series, but stop after day 4, or you skip 6 days and then try to restart, pick up where you left off, the efficacy of those antibiotics, it decreases, right?
Yeah.
So acupuncture is very similar in that consistency is really, really important to get substantial lasting results. Um, the frequency of this can vary though. So let's say you do agree to those 10 treatments. It's common to do 1 session per week, but there are times where your acupuncturist might suggest you do twice in 1 week. Maybe that's because you're in the middle of a flare up and either you're in a lot of pain or the fatigue is severe, whatever the case may be, that the frequency might change slightly. But your acupuncturist will work with you on the best treatment plan.
Nice. Okay.
Mhm.
Next up, we have, can acupuncture help with specific joint pain and fibromyalgia? Do you have a lot of those cases in your practice?
I do, yes. It's very common for me to see just joint pain, whether that's like RA, rheumatoid arthritis, or fibro. Acupuncture's ability to regulate blood flow and reduce inflammation in the body enables it to help with those things.
Okay.
So I often will have patients who experience decreased discomfort and pain after acupuncture treatments. So it can be really helpful. Mhm.
Nice. Okay. Can your rheumatologist write you a referral for acupuncture so insurance will cover it? Is that typically the pattern that you see? Someone talks to their doctor first or their rheumatologist and gets referred?
Yeah, so that is a great question. And I hate to always start everything. Well, it depends, but it
Yeah, of
does depend a
course.
little bit. It
Yeah.
depends a little bit. So it depends on your insurance. Yes, your rheumatologist or your PCP can write a referral, but that doesn't necessarily guarantee that your insurance will cover it. So it varies from insurance company to insurance company. So you would want to follow up with your insurance provider to be sure that you have coverage, because in addition to a referral, they sometimes have other forms they want you to fill out, or will only cover certain acupuncture. I mean, will only cover acupuncture for certain diagnoses. So it very much depends. But I see a mix of patients. Some come based on referrals, but some also come on their own without a referral. And I've seen that still be covered by acupuncture. I mean, by their insurance providers. So
Okay.
it varies greatly. Yeah.
So do a little bit of research.
Yeah.
Gotcha. And this is my favorite one we've gotten so far. What is chi? Is chi messed up in lupus? What does Chinese medicine say about autoimmune disease?
I love that question. I love that question. So I could go on about this one for a while, but
Nice.
I'll try to keep it concise and hope it makes as much sense as possible. But so what is chi? Chi is our vital energy, is often what it's referred to. It's the life source in our bodies. It's the basis of how all things exist, both in form and in function. So, for example, when chi condenses, it creates tangible things like our human body. And when chi disperses, it creates intangible things like our heartbeat or the rhythm of our breathing. And it's this energy that flows through the primary channels that I mentioned earlier, like the large intestine channel, spleen channel, lung channel, all the ones that cover the body from head to toe. And so is chi messed up in lupus? She's messed up in a lot of ways. According to traditional Chinese medicine, all the activities of the body can be explained by changes in the movement of chi. So that can be both positive and negative. So there may be a blockage or stagnation of chi. There could be a deficiency of chi. It all depends on the presenting symptoms. And so in the case of autoimmune disorders, there's typically a combination of stagnation and deficiency that involves not only chi, but other vital substances in the body that are acknowledged by Chinese medicine, like yin and yang. Those are both substances in the body. And so uh, because lupus and other autoimmune diseases can present themselves in people differently, each person may have a slightly different Chinese medicine diagnosis. But no matter what, keeping yin and yang balanced in the body is key to preventing and treating autoimmune diseases in Chinese medicine theory.
Got
So,
it. That was a great little mini mini overview.
oh, good. I'm glad. I was like, I don't want to get too in the weeds, but I
Yeah,
hope that
no,
makes sense.
it's great. Our next question is, can you feel the needles?
Yeah.
Valid
So,
question.
very valid question. And yes, but I will say feeling them and experiencing pain because of them are two different things. So
Sure.
you do often feel a quick tap when the needles are inserted. But generally it's pretty painless because the needles are so tiny and they're so thin. They're about, to give you comparison, they're about as thick as a strand of hair. So they're very small, which means that insertion, although you do feel a little bit of a tap, it doesn't feel like much. I don't have any patient that categorizes it as pain. They just say, oh, you feel a little tap and then it's over. Okay.
Okay.
But once the needles are in, there's a couple different things that you could feel. You could feel nothing, which is totally fine, but you also might feel some tingling. You could feel some warmth. You may feel a muscle twitch or experience like an aching sensation for a moment. All of these are normal, and typically those sensations subside after a few seconds anyways. So
Okay.
yeah, just to give you a little context.
Nothing to worry about on those.
Yeah. Hmm.
Next question is, how long is a session? Do you just lie there?
Yes, actually you do.
Sounds wonderful.
Uh, yes. So the length of the appointment depends, it depends on the clinic. So some places allot up to 2 hours for the first appointment in order to get like a full health history. But generally speaking, appointments are approximately an hour long. And this includes time for intake and conversation and the time that you are receiving the acupuncture. And so yes, you do just lay there. Many people doze off and they use it as nap time, which is totally fine by me. I love when grown-ups take a nap. I think that's fantastic. The only thing that while you are laying there, the only thing I want you to remember is to stay still. Movement can cause pain. So if you lay on the table and you're in a particular position, don't shift positions once the acupuncturist leaves the room because that might be uncomfortable. But otherwise,
Understood.
yeah, you just lay there.
Nice.
Mhm.
Does it matter if you're on certain medications during? I mean, I imagine this is a question for your doctor and your unique case, but are there any like key medications that are an issue that would be contraindicated with acupuncture?
That is a good question. And for acupuncture, no, actually, it does not matter what medications you are on. Um, the only thing I will say is if your acupuncturist recommends herbs, then it absolutely matters.
Yeah.
It is not uncommon for acupuncturists, including myself, to prescribe herbal formulas. But whoever you are seeing, make sure that they run a drug herb interaction analysis to ensure that there are no adverse reactions. Because there are lots of herbs and lots of like Western medicine
Yeah.
pharmaceuticals that are safe to take together, but there are a lot that are not safe to take together. So you always want to be sure that whatever you're taking has been screened first
Yeah.
before you proceed. But as far as the acupuncture itself, acupuncture on its own, completely safe, and there's no real concern around what medications you're taking.
Okay, perfect. And just as a follow-up to that, can I ask, since pharmacists typically can't advise on like herbal mixtures, and that's normally not something that they weigh in on very
Yeah.
frequently, is that something that you should rely on your acupuncturist for support on?
Yeah, yeah. So most often you'll need to rely on your acupuncturist. In that case, as you said, most providers don't have that training, and so they won't advise, they won't give any advice around that because they just don't know. But your acupuncturist typically will have a better idea of what's safe to take with what. And there are also programs that I even use personally online that are available to providers to double check that is this formula safe to take with this prescription? Is there any like, and sometimes it's important to do that because there are levels to the interaction. So there could be like moderate interaction or like severe, definitely do not take these together interactions. So it's a little bit nuanced, but ideally you would rely on your acupuncturist or your functional medicine doctor or something like that, who is a bit more versed in the world of supplements and herbal medicine.
Understood.
Mhm.
Okay. And
Yeah.
then I think we talked about this a little bit in your intro,
Yeah.
but someone asked, have you ever had a lupus patient that improved their flares with acupuncture? If so, can you tell us a little bit about that?
Yeah, absolutely. So, yes, I have. It definitely can be very helpful at reducing the frequency of flare-ups and decreasing the amount of pain that you experience when flare-ups still occur. So I definitely recommend giving it a try. But again, I think the most important thing to keep in mind is that the acupuncture it's not a magic trick. It's not a one and done. It's not a you had lupus last night and now everything is better the following morning. It does take a bit of consistency in treatments. So going back to kind of how often do you get acupuncture, that is really important because you could get one treatment and you might feel okay afterwards, but the goal is to get you to a much more balanced, happy, healthy state. And so that takes time. So committing to a series of acupuncture, like I said, that ten treatments is really important to get those kinds of results. But I do get them. Yeah.
Nice. Okay,
Mhm.
thanks for sharing that. I that actually looks like all of our questions. Um,
Lovely.
before we wrap up, is there anything that you would share with the community members who maybe have never done this and they're thinking about potentially pursuing it? Is there any other advice or anything that you would kind of throw our way for someone who would be a first timer?
Yeah, I would say well, actually, first thing is check with your insurance because if they do cover it, I'm all about using every benefit your insurance provides. So if they do cover it, absolutely start there to double check. Um, Otherwise, I think that you guys are in a great location. There are so many wonderful acupuncturists in the kind of greater LA county. Uh,
Mhm.
and so I'm happy to send a couple recommendations. If people are
Great.
kind of like, I don't even know where to start, I'm happy to share some of those with you to give you some options. Like I said, when it comes to particularly if your insurance doesn't cover it, getting you the information for some of those schools that provide acupuncture at a reduced rate. Also, TIA is in LA and we have, I think, 5 or 6 locations there. So that's an option as well.
Okay.
But when you go to your first acupuncture appointment, sometimes there's a little bit of nervousness around like, well, I don't know what to tell them. I don't know what they really can do for me. Um, Rest assured, your acupuncturist does know what they can do for you. So it really is, you can come in and you can say to them, some lady on Facebook told me that this might be a good idea. And so that's why I'm here. And they'll be like, okay, cool. And they will guide the conversation. They'll help to kind of get the information that they need in order to provide you with a good treatment so that you can gain benefits from it. But don't be nervous. You are in good hands. Yeah.
Great. Before we sign off, is there a certain certification that the community should be looking for in a practitioner or a certain degree or um,
Yeah, that's a great question. So, as an acupuncturist, it's particularly in California because this can vary from state to state, but in California, to practice acupuncture, you ideally will have your master's. There are some other ways that people will start to practice acupuncture and Chinese medicine. But I tend to push towards, if you're looking for an acupuncturist, look for the ones that either have their master's in acupuncture and Chinese medicine, or have their doctorate. I happen to have both, but you don't have to have both in order to be a good acupuncturist. So look for somebody who is a licensed acupuncturist in the state of California and has their master's. That's the best place to start.
Perfect. Well, thank you so much for sharing so much information. This was really helpful.
No
We
problem.
appreciate your time. And just to anyone listening who may be new to the community, to get notifications about upcoming live expert sessions and events, or just to join our community, just head to the comments. There's a link to click to join our community, and you'll get email notifications for future sessions like this one. Thanks so much, Dr. Erica. We really appreciate it.
Of course. Thank you all.